My name is Martin Fox, and I started out 27 years ago as a general podiatrist, having qualified from the university in Salford. Currently, I'm a community-based vascular specialist podiatrist responsible for a service which was set up by ourselves 9 years ago in Manchester to provide accessible local assessment, diagnosis and triage of people with suspected lower limb peripheral arterial disease. Historically, anybody with suspected lower limb arterial disease has been referred to hospitals to be seen by the hospital vascular team. But we know from the evidence and the studies that probably about 80% of those people didn't need to go to a hospital, but they did need a clinician who could assess, diagnose and make clinical decisions about their treatment. From being a general podiatrist, I guess I wanted to specialise into something interesting, clinically focused and important. I had an urge to travel, mid-20s, who doesn't? And I chased the idea of introducing podiatry in a very extreme environment, such as somewhere like Africa or India. I couldn't at that point get any opportunities because podiatry wasn't well known, unlike other healthcare professions such as physiotherapy, medicine or nursing. But I eventually got a slot to an invite to come to an Indian leprosy clinic and ended up working there as a volunteer for a year. And I came back to the UK. I wanted to work in high-risk lower limb care, wound care, which was a reflection on some of the leprosy work. I got into that, working with diabetes and complex wounds and amputation prevention. And ultimately, I realised there was a gap in the fact that people were coming to our clinics, our multidisciplinary clinics, very late with end-stage disease, and there seemed to be nothing around for championing early diagnosis of things like peripheral arterial disease. And I spent the last probably 10 years of my career attempting with my vascular colleagues, my diabetes colleagues, other health professionals around me, to fill that gap by providing a very focused clinical role that's about assessment, diagnosis and management of lower limb disease. I've been working probably over the last 7 years, not just as a clinician, which is my day-to-day job in the clinic, seeing the patients, assessing, making decisions, communicating, but trying to influence policy at the local, regional and national level. So working with the CCGs, working with regional effectiveness guidelines within my profession, and then working with national bodies, multidisciplinary bodies such as NICE, where we're looking at actually impacting on the guidance that's produced to make sure that the assessment and clinical diagnosis and treatment that the patients are ultimately recommended to get are at the highest evidence level. So I found it really exciting in the last few years of my career to get involved in that as well as the clinical sort of foundation to it all. And I couldn't do that bit without being a really strong expert clinician supported by a great healthcare team around me. I've written articles for many journals. I presented locally in the UK to other professional bodies. I've been very proud to be on the NICE guideline committees and to be involved in steering healthcare policy in the UK. I mean, I'm a podiatrist from Manchester, and yet this has become a reality through pushing myself and having the genuine support of colleagues around me. I think once people feel they can get where you're going with this and you've got a vision and a passion for something that's tangible, they tend to work with you and you can really take that forward with support. I was given advice early on by a particular colleague who told me that I was bright and told me that I was very limited in my thinking, and I took it at the time as a bit of a criticism, I have to say. But I reflected on it and I agreed with it after some thought, and I realised that the only person who was going to get me out of that box was myself. And I think it's that making it happen and looking at the opportunities and the potential for your skill set and particularly your passion. If you've got a passion for a certain area of practice, clinical practice or research or healthcare development, I think you can really explore that if you take yourself out of that little comfort box. But you have to do it. You've got to make the first step at some point in your career.